My videos on pain in the piriformis muscle are among the most popular ones in my channel, which means that a lot of you feel this buttock pain that sometimes radiates as a sciatic pain, which actually mimics a sciatica because it's a compression of the sciatic nerve, but instead of being here at spinal level, it's one level lower in the piriformis, but it's a compression of the same nerve as if you would have a disc hernia. And for some people, doing the stretch that I've recommended in the video, for reference I link it at the end of this one, so doing this stretch is difficult. So what I'd like to do in this one is decompose the stretch of the piriformis muscle and show you what you can do if you have, say, so much pain that you don't manage to do the stretch properly. So let's go and have a deeper look at what this stretch is and how we should do it. So this is the stretch of the piriformis muscle. You see, I was having my lower leg horizontal, my knee in direction of the opposite shoulder, and I go like this without lifting my buttocks. Yeah, and there I feel a stretch here. Okay, now this means that there are two components in this stretch. Component number one is that I manage to have my lower leg perpendicular to the line of my body, as you can see here. Component number two is that I bring my knee inwards in direction of the opposite shoulder. So that's inwards and kind of upwards in direction of my head also. This will be super difficult if you have pain. So what can you do? You can use your belt. So you see, I'm gonna put my belt around my ankle and we're gonna go step by step, you know. If I cannot have my leg all the way perpendicular, well, that doesn't matter. Already, if I manage to have it 45 degrees, it's already good. And then I'm gonna bring my knee as far as it can go. And if it cannot go further than that today, well, that's okay, you know. It's just like this. And tomorrow, I will maybe manage to bring my leg a bit more perpendicular, and then a bit more, and then a bit more. But I start maybe with the leg here, and maybe I don't manage to pull this far. Maybe it just stays there. But, you know, using a belt to hold your ankle will allow you to, say, be more progressive in the stretch, which otherwise depends on the length of your arm. You see, if your arm is as short as mine, you have no choice. You have to have your leg perpendicular. And as we're talking about different stretches, you will also find this variant. Why don't I like this variant? Well, several reasons. Reason number one is that you're actually kind of resting your weight on the muscle that you're stretching. And you know, intuitively, I'm not a great fan of putting pressure on fibers that I then pull. You know, that must create a resistance. So that's reason number one. Number two, at the beginning of this video, I told you that the pain of the piriformis muscle is exactly like the pain of a hernia. And what causes a hernia is when your back is round and compressed. Well, look, how is your back here? It will be round and compressed. So actually, when you're doing this stretch, chances are big that you overload your discs. Do you really want to overload your discs when you have pain that looks like sciatic pain? Or actually, do you ever want to overload your discs? I mean, you know, I don't think it's a great thing. So this is why lying down will be a safer way to stretch your piriformis. The very same reasoning applies to this version of the stretch. Well, here it's easier to keep my back flat, but still there is weight, my weight, say, on the piriformis, and there's a lot of pressure on my hip joint because, you know, whereas when I lie down, I bring the weight of my leg, what I'm doing now is bringing the weight of my torso, and this is heavier. So that stretch puts more pressure on the tissues, both the hip joint and the piriformis muscle, than when you lie down. As you can see when you visit other channels, there is a lot of debate on how to stretch this or that muscle. What I find important is two things. One is that you understand what the difference between stretching like this and stretching like that is. That's number one. You really should not do things blindly. You should understand what you do, then do it. Second point is, well, feel for yourself what works best and stick to that. You know, I have a certain point of view which has shown to be really quite effective with both my patients, so people that I know and people that I don't know who have bought my book, the posture manual, and who send me feedback saying, well, your exercises are great, but it's just one point of view among others.